Hi, I'm Srini Ganesan, Senior Director with OneBridge Technologies. And today I will be talking about healthcare data mesh. So the context for healthcare data mesh essentially originates from the aspirations of healthcare organizations to get to a single view of their various entities they deal with. So for example, patients and members and the populations they're serving to actually get better outcomes for them. Now, the challenges in this space essentially comes from, again, trying to look at the data that originates from the EMRs, the clinical systems, and any other external social determinants, which are actually essential to build a single golden record for the patient or the member or the population that is being served. The aspect of what goes on here essentially is about trying to put together some very specific data as a product solutions, which basically tries to integrate data from multiple different sources and kind of serves them as data product packages, which can be actually used for downstream consumption. Now, some of the examples typically fall into population health analytics, which is predominantly used on the provider side. But on the payer side, there's an extension of this more in terms of member wellness and how they actually use that specifically in terms of member engagement. And if you take this to the pharma companies, it is more in terms of trying to really understand the patient population they're serving, more in the clinical trial space for them to actually attract them specifically for enrollment, keep them as part of the clinical trials. Now, if you really look at in terms of the approach, the overall approach, the approach basically is into 5 different steps. The first one is more in terms of identifying the sources which have to be brought together. Then second one is more in terms of curating that data, sanitizing that data, and bringing that to a level of quality set so that it can be actually taken and storage and organized. The third part more in terms of how the data is actually taken and served is where the data as a product or the data mesh exists. So the data mesh essentially is a consortium of use cases which actually get served through either through self-service or various other application layers, so that it can be served to a BI and analytics tool, or it could be served to any kind of solutions which actually spring up on the digital ecosystem. Now, typical examples of how this is actually taken, like on the provider side, as I talked about, population health is a big space where this is used quite a bit in terms of identifying the cohort of patients, trying to make sure that they basically can be served and engaged. And on the clinical trial, it's more in terms of the feasibility and kind of taking and doing, identifying patient population. And on the payer side, more in terms of integrating social determinants so that you can actually devise strategies for member engagement. So essentially, this summarizes some of the use cases where the healthcare data mesh is put to use and some of the use cases that are actually predominantly used across the healthcare organizations.